April is Alcohol Awareness Month. We're joined live by Sharon Schmidt from the Kent County Health Department to talk about what this means for our community and how to make safer choices. Let's start with the big picture. What is Alcohol Awareness Month? Why is this something we should be paying attention to?
Alcohol Awareness Month is a time to look at your drinking patterns. Alcohol is the most commonly used substance in the United States for people 12 and older. So it's legal, it's socially acceptable, it's easily accessible, and so it can get out of control a little bit. So this is a time that you might want to look at your drinking habits, your drinking patterns, or maybe there's someone in your family or a friend that you want to have a conversation with.
Yeah, it's definitely a good time to have those important conversations when we're thinking of words like, binge drinking, maybe heavy drinking, or just the casual drink. Taking time to assess that is really what this is all about. Speaking of binge drinking and heavy drinking, what are those? Is there a difference there? What should we know about the two terms?
The two terms are different. They do represent different things. We'll start though with what moderate drinking is, or drinking in moderation. And according to the U.S. dietary guidelines, moderate drinking is one drink, no more than one drink per day for women, and no more than 2 drinks per day for men. So when we're talking about binge drinking, that's drinking a lot of alcohol in a short amount of time.
Okay.
4 or more drinks in a single setting, so about 2 to maybe 3 hours for a woman, and then 5 or more drinks in that same amount of time for a man. Heavy drinking then looks at over a period of like a week. So 8 or more drinks per week for a woman would be considered heavy drinking, and 15 drinks or more during a week would be considered heavy drinking for a man.
Okay, interesting. So those are the definitions. It's really more so about the period of time is what I'm hearing, right?
You do want to pay attention to the period of time. Certainly you can have a couple of glasses of wine when you're out or at home, but we really do recommend that put a glass of water in between those, or sip a club soda, or sip something that's non-alcoholic in between those drinks. Just slow it down. We're not telling you can't drink, but just do it slow, do it in moderation.
And again, trying to reassess those habits during this month.
Yeah, just having people be more self-aware during this month, of course. Kent County's latest health assessment, too, has recently shown some concerning trends, it sounds like. What does that look like today locally?
Well, let's go nationally first. Nationally, we know that excessive drinking causes nearly 180,000 deaths. There's an alcohol relation to about 180,000 deaths per year. So when we look locally, we know that here in Kent County, binge drinking is more common in our residents than heavy drinking. However, what we saw in our 2023 Community Health Needs Assessment, which is the most recent data that we have, our rates of heavy drinking increased across nearly almost every demographic that we surveyed. And that's concerning because we've been keeping track of this data for over 10 years, since 2014, and these are the highest heavy drinking rates that we've seen in all of the data that we've collected over those years.
Is there a reason you can point to as that being the cause for the spike here, or is it just kind of over time, generally things have picked up more and more?
I think just generally over time, again, socially acceptable drinking, it's easily accessible. So many of our events and celebrations have alcohol as a component. And when you're out with a group of friends, it can be sometimes easy to lose track a little bit about, how much you've had to drink.
Yeah.
So when somebody's looking at their behaviors, their habits, and they're thinking about maybe how much they're drinking, what would be a sign, some warning signs that they would want to look out for to make sure that they're staying on the healthier side of things, or look out for in their loved ones, just to make sure that they would get help if they need to?
Yeah, warning signs in yourself or in family members or friends might include things like, is the drinking interfering with your daily activities? So are you able to get up and go to work? Can you get the kids off to school? Can you get to work or school, depending on what your role is? So how that it plays a role. Have you tried to stop or cut back and found that very difficult? Are your family members, are your friends making comments about your drinking? Either as you're going out, so how much are you going to drink tonight? Or maybe the next morning, the behavior that you had last night, that wasn't good. So what kind of comments might they be making? Other things that might be a warning signal would be if you're drinking more than what you used to get that same effect. And when you're not drinking, are you thinking about drinking and when your next drink is going to be?
Interesting. So let's say that we do notice a pattern, or we are seeing some concerning behavior from somebody that we care about. Is there a way to go about having that conversation with them? And if so, what do you recommend?
Ooh, that can be tricky.
Yeah, it's sticky subject,
Yeah.
right? You don't want to be
can
the person
be.
to bring that up.
Absolutely, because you're dealing with a legal substance. As long as you're 21 or over, it's legal for people to use. So that conversation can be tricky. You know the relationship you have with that person, and I think you have to judge how much you can push. Or how blunt you can be about that. But if you're not comfortable, you can always seek some professional help. We have resources here in this community that might be able to guide you on having that conversation.
What about certain groups that might be at risk more than others? Obviously, we don't really want to see teenagers drinking, and I'm sure that's probably what you're going to talk about.
That is number one on my list.
Yep.
For people who shouldn't be drinking, anyone who's under 21 should not be having alcohol. But they're not the only group. So women who might become pregnant or are pregnant shouldn't be drinking alcohol. People with certain medical conditions or taking certain medications, prescription or over the counter, alcohol can interact with medications and cause some serious harm. Anybody who has trouble controlling their drinking, if they know that, if I have one, it's just going to get out of control, then they shouldn't even start.
Yeah.
And anybody who's in recovery from alcohol use disorder shouldn't do that, because that might trigger a relapse for them. And then anyone who's going to be doing any type of activities that require coordination or skill, like driving a car or operating heavy machinery.
Probably shouldn't do both.
Probably shouldn't.
Actually, don't do both.
Yeah.
Don't, yes, absolutely, and we forget, even if you're gonna operate power tools or something like that, you need a clear head to do that kind of work safely. So those are the groups that, even in moderation, alcohol use isn't recommended.
For sure. So all of this also comes back to the campaign of About Last Night. Can you tell us a little bit more about that and how it aims to teach young adults about this subject?
About Last Night is a campaign that was started by the health department in 2012. And the priority population was, and still is, young adults 21 to 34. Again, it's not an abstinence campaign. We're not telling people that you can't drink. We just want you to think about your drinking, do it in moderation, slow down when you're doing it. And we saw at the time that age group was where the binge and heavy drinking was a little bit higher. And now with this latest data, we're seeing the trends going more towards the early 40s where the binge and heavy drinking numbers are a little bit higher. So we're broadening our population a little bit. But again, getting that message out that, slow down. The heavy drinking, if you do that over a long period of time, that could really have some effects on your health, on your mental health, on your relationships. Just getting that message out.
Yeah, and unfortunately we have to leave the conversation there, but we appreciate your insight, Sharon. And if you want to learn more about their program or any other tips to during this Alcohol Awareness Month, you can do so on the Kent County Health Department website.